It is an amazing time in AI right now. It is really transformational. We think about Moore's Law and how quickly things are changing, and AI is changing so rapidly. I think in 1 year, practice will look quite different. Practices and organizations are already incorporating AI tools to make us more efficient and effective in the clinic. And we really need to think about it carefully because even with a perfect tool, implementation is challenging. There are hazards, bias, errors that can occur that we need to be cognizant of, but we will all be using AI, and if we don't, it's probably just because we've retired from the workforce. So we'll all be using AI in different aspects of care delivery. I talked a little bit about that, the different ways we're incorporating AI. I think for clinicians, some easy first ways are the digital AI scribe is one functionality that people are using. In Texas Oncology, my practice, we've onboarded about 500 doctors using an AI scribe in the last year. We're using chart summarization, ICD-10 coding suggestions. It's clinical decision support, so it doesn't supplant our autonomous decisions. The chart summarization piece for clinical trial eligibility is really important. So those are some tools that we're using in practice today, but I suspect that we'll be using AI more for things like prior authorization and some more administrative tasks as well, which are really meaningful. I think practices can't engage like this alone without really being cognizant of responsible use of AI. And over this last year, I've been chairing the AI Task Force for ASCO. We've developed a set of principles for the ethical and responsible use of AI, which I think are really important and should guide individuals and organizations as they navigate this space. We do. We have an ongoing pilot to identify eligibility, to screen patients for eligibility to provide more clinical trial access to more people. It's very exciting because I think across adult oncology, it's a real limitation that most patients don't have access to clinical trials. And honestly, as a clinician, it's a huge commitment of time because it takes like 4 times as long to talk to a patient about a clinical trial as it does a standard of care therapy. And so to have tools to make that easier, to select patients, to do some of that early heavy lifting first is a really important way to try to bolster giving that opportunity to the patients we serve. I think it's really important, and I suspect in a year or two, everyone will have this in their practice. Everywhere, all at once. The NCI has made it a priority, but really everyone has made it a priority. The NCI has come out with some really interesting tools around clinical research that are very exciting, but I think this is a robust area of research that we will continue to invest in and develop, and it will change the landscape of where we deliver care. I'll bucket it in 3 buckets. The first is the real hazards, right? And these are well described in AI, things like data fabrication, bias, hallucinations in large language models. So those are some hazards. And I would say that I suspect that those will improve over time. They're never going to go away, but they're going to improve over time. And more importantly, we are just going to understand and better navigate those limitations. I think every tool we use in clinical practice has some limitations, and so we will never eliminate them. But I think understanding them and how we use things to try to mitigate those as much as possible is our best path forward. But the 2 others that I think people don't think about initially with AI, and they're so important that I feel like I've learned from the scars of experience of implementing some of these systems, is implementation is very tricky. So implementation science is a really important study, and having people that are experts in implementation science I think is really important. And then change management within organizations as you change processes so fundamentally in how you care for patients is really critical. And I think that you can have the best system in the world, but you can fail at implementation and at change management, and it'll be a complete failure. So those are really important aspects of AI implementation and any kind of digital healthcare transformation that people really can't neglect. I think that a lot of transparency in the system is really important, because you're never going to be able to take away the problems, right, entirely. But you need to understand where they are, you need to understand where they have limitations, and that's the best way to think about how you can use a tool. And I will just sort of take it back to a very fundamental example. Think about an early tool that you use. Think about a hammer, right? Hammer does a lot of good things. Does a hammer have problems? Sure, I've hit my thumb quite a few times. There are always some hazards that a hammer has. Now, as an adult that's used a hammer for a long time, I'm much better at using a hammer and avoiding the thumb problem, right? I think you could think about AI very simplistically in a similar way. We have to become more familiar with it, but even having transparency in the data isn't going to be perfect, because, for example, if you have data all on one subset of individuals, if that demographic, age distribution, comorbid illness distribution doesn't match your patient, it's going to introduce biases that make it somewhat limited in the application to your patient. And so, I just think that you need to be cognizant of those limitations as you use these tools in your practice.